to Columbus, where the local time is 11:19. Please remain seated with your seatbelt securely fastened until the aircraft is parked at the gate and the captain has turned off the seatbelt sign.
You're not in it though.
I'm not?
Nope.
Do you need to shut this door?
Yeah, please shut the door. Yeah, now you're in it.
Am I all the way in?
Yes.
Or partially?
Well, you're slide over closer. I would say right there. Now, can you kind of see it?
Okay.
You see where you are?
Yes.
Now I'm all the way.
Here.
So yeah.
So here is good.
You're good. Hello, my name is Gabe Howard and I'm a mental health advocate. I'm a bipolar speaker and writer. I live with bipolar disorder and anxiety. I have a top 10 podcast on YouTube called The Psych Central Show, and it's really my job and goal and life's work to have more conversations surrounding mental health, mental illness, and psychology, because we all experience this, yet most people aren't talking about it. And then when a mental health crisis or a mental illness issue occurs, we're sort of behind the 8 ball as a society because we don't know how to react. So I'm looking to kind of flip the script on that and get people to get knowledge before they need it rather than after.
Okay, so when were you formally diagnosed?
I was formally diagnosed in 2003. And I was admitted to a psychiatric hospital, and I really speak from experience when I say that I had to learn all of this after the fact. The day before I was diagnosed, knew nothing about mental illness, nothing about mental health. I thought I was interested in psychology, but yeah, I wasn't. And then I'm diagnosed, I'm in a hospital, I'm in literally a locked psychiatric ward, and I needed to learn everything instantly. And of course, needing to learn everything instantly is just a very bad way to try to learn anything. And I really wish that I would have had a lot of knowledge ahead of time, because I think if I would have been diagnosed sooner, I probably wouldn't have been suicidal or in crisis. And of course, it could have turned out poorly. I mean, thankfully, I ended up in a psychiatric hospital. I very easily could have ended up in jail. I could have ended up in the morgue. It could have turned out a lot worse. And I think what's interesting is people are like, oh, you were in a locked psychiatric ward? Like, that's the worst case scenario. And interestingly, it's not. That's like the best case scenario for somebody that has untreated mental illness that they're unaware of and that they're doing nothing about. A psychiatric ward is the best case. It could get a lot worse. Okay,
so what was the worst thing about being in the psychiatric ward?
The worst thing about being in the psychiatric ward is it's a complete lack of control. It's locked. The doors are locked. Everything is controlled, regimented. When I checked in, they took stuff from me. Things that I brought in from home to like make myself feel better in the hospital. They're like, you can't have that. My girlfriend at the time, she brought me my favorite drink, and they were like, no, that has caffeine in it. He can't have it. I'm just like, I'm a grown man. What do you mean I can't have it? I can have whatever I want. At the end of the first visit, I wanted to walk her to the elevator, but the locked doors were here and the elevator was here, and there was a window and I could see it. And they were just like, no, you can't. And I was like, what do you mean I can't? I'm a grown man. I'm dating this woman. It's right there. And they weren't kidding. They were not going to let me walk across that. And that's just, that's kind of devastating to your psyche a little bit, because I'm like, grown. They're like, no. It is for my own good. I do want to be fair. People listening to this, they might think, why are they so mean to you there? I'm like, no, they're trying to keep me alive. I was there because I was suicidal. They can't control the area outside that door. But from my perspective in that moment, I just felt weak. And of course, there was a woman involved, so I felt emasculated. Like, I can't even walk my girlfriend to the elevator. Like, I'm now like rude. It was incredibly confusing. Those are the big things that I remember, just how little agency that I had, and I didn't understand it. And that was scary.
Does mental illness run in your family?
Not really. It's fascinating, because as soon as I was diagnosed with bipolar disorder and anxiety disorder, and a few little pockets kind of came out of the woodwork. My father said, that he has suffered from some depression and anxiety his whole life. And I'm like, that would have been good to know. Why didn't you tell me? He also told me that he'd seen a therapist for like a decade. And, my dad is a truck driver. I mean, the 18-wheeler, diesel everywhere. I mean, just the big, you go like this when they drive by and he honks. So I really saw my dad as kind of like the tough man's man kind of guy. And he certainly portrayed that. I mean, he didn't do anything to convince me that that wasn't true. But then he tells me that he's in therapy and that he has anxiety and that he's felt emotion. I was like, I didn't know that. Like, that would have been good to know. I thought like men were tough and stoic. And he's like, no, men act tough and stoic. I'm like, well, I wish you would have told me that because I really thought that my feelings were bad. In my family, I had some past relatives that people were like, oh my God, they had some of these symptoms that you have, they had them too. I wonder if they could have benefited from treatment for depression or just somebody to talk to, but everybody was just kind of hush-hush about it. So this is really where I think, I don't know that anybody in my family had like severe and persistent mental illness, like bipolar disorder, major depression, schizophrenia, psychosis. But I think a lot of people in my family had mental health concerns, whether it be, grief or situational depression or anxiety or just things that they needed help getting over that they sort of shamed themselves into being quiet about. And that's certainly no good. So while I get to be original, the only bipolar,
yes.
I think that there was just these huge discussions surrounding mental health that my family should have had a long time ago. And because of my diagnosis, they have now. So, my family is woke. We're woke. All it took was, me almost dying, going to a psychiatric hospital, and hey, now we're all discussing, our emotions and feelings. I could work for your family too.
So not that everyone's woke, right?
Right.
When they were all asleep. Right?
Yeah, when they were unwoke.
When they were unwoke.
I think it's unwoke.
When they were unwoke. How did that affect or impact your ability to have a good care or to understand what you were going through?
I thought that I was bad. Mm-hmm. Let's go back to like my teenage years.
Okay.
And we're going to talk specifically between like the ages of 14 to 18. I had the symptoms of bipolar disorder like loud and clear, from the depression to the staying up all night for days to the mania to not listening to people to the grandiosity. And my parents believed that all of these things were behavioral issues. And my parents wanted me to be a good guy. I faulted them at the time, like major big time. But what my parents were thinking is we have to stop this behavior. Gabe can't act this way if he hopes to, get a good job, if he hopes to graduate high school, go on to college, whatever. He needs to calm down. So my parents literally punished the symptoms of bipolar disorder, which made me feel horrible. I thought I thought these were personality flaws. I thought I was a bad person. And I thought that my parents didn't understand me, which of course they didn't, but not for the reasons that I thought. And it made them not like me because I wasn't listening. It made me not like them because they were punishing me for things that I couldn't control. None of us were on the same page. So as time went on, there was just a distance. I felt more and more isolated from my family. And while I don't know exactly what they thought, what they were thinking is Gabe's not doing what he's supposed to be doing. And we need him to do this. For example, in depression, I wouldn't get up and go to school. So I missed a lot of school. So here's my dad pounding on my bedroom door, and all he wants is for me to get out of bed and go to school, which is not unreasonable. But of course, he's yelling at this at a guy that's laying in bed contemplating death because he's so depressed he just can't move. So you can see we're being screamed at by your father when you're like, hey, should I live or should I die? I hate myself. And then your father's yelling at you. That's not helpful either. So all of us were just in this just nightmare feedback circle where we all made each other miserable. So that hurt.
Okay.
That's really the best thing that I can say. That hurt. And a follow-up to this to say, because now we've moved on. Now I became an adult. We moved. My parents moved away. My father got transferred. So now there's 700 miles in between us, which in a way helped our relationship because I just reported back all the good things that I did. Mom, Dad, I got a job. Oh, we're so proud. Mom, Dad, I bought a house. Oh, we're so proud. Mom, Dad, I got a promotion. Oh, we're so proud. And then I didn't call them about staying up for 4 days or drug abuse, alcohol abuse, hypersexuality. These were just things I didn't tell them. And because they were so far away, they just kind of saw got job, and they started to be relieved a little that, hey, he turned out okay. But I was still pretty mad at them, and of course I was still having all of that internal struggle. I still felt bad, and I still blamed them for making me feel bad. And again, we never addressed it. It was just, I want to say that it was the elephant in the room, but I don't know that we even realized it was in the room. We just had trouble connecting. And I don't think that anybody understood why. And then, one day I'm diagnosed and then we're all confused. I always wrap up kind of this portion to say, because there's a lot of parents out there and there's a lot of people like me out there. My parents are not a good example of how to treat your mentally ill loved one. I want to be clear on that. Nobody should write a book called, Do It Gabe's Parents' Way, because everything that they did was wrong. But here's where somebody should write a book. My parents didn't quit. They never gave up. They made mistake after mistake after mistake, and they were there. They showed up to make the mistake, and even after the mistake went bad, they regrouped and made a new plan. And, that kind of moxie can't be taught. But they could have been taught what to do. And if my parents would have known what to do, they would have used all of their energy, all of their gumption, and all of their resources doing the right thing. So there was no lack of love. There was no lack of caring. They just didn't know. They didn't know what to do, so they had to guess. And guessing never works. It just doesn't work. And that's why I'm such a firm believer in education, because it would have helped me and helped my family. And while it did turn out great for my family, yay us, it might not have. Okay. My family could be the people wandering around talking about their son who died by suicide. They could be that broken image that we see a lot when people are saying, why did this happen? And it terrifies me that could have been them over information that frankly is readily available.
Let's revisit age 13, because I read the blog and I was very moved by it.
Sickle cell anemia?
No, trichotillomania.
Trichotillomania.
So trichotillomania is a word that I learned from reading your blog about your pulling out of your hair when you were at age 13. So you speak about all of these signs that your parents missed, including the behavioral aspect of it. Let's go back to when you were pulling your hair out.
Okay.
You spoke of growing your hair out into a ponytail, and then started playing with it.
Yep.
And then gradually playing with it to the point where that play became more aggressive.
Yes.
So let's talk about that a little bit, because maybe there's kids out there that are exhibiting the same exact behavior, and the parents, maybe they don't know that this is what they're displaying. So go ahead and speak on that.
Well, like you said, this started when I was about 13 years old. I literally started petting my hair. So like this, just kind of playing with it. So it moved slowly. I want you to kind of see this from my family's perspective, and then it just got a little worse, and it got a little worse, and again, eventually I was just yanking on it so hard that clumps were coming out, and my family thought, well, the reason that this happened, and I can hear my grandmother saying this, it's because you grew that ponytail. If we never would have let you have a ponytail, you wouldn't have done it. And that's really what they believed. And not because, I guess that is kind of stupid, but it's not. It's reasonable. They didn't think about their grandson, their son, as being a mentally ill person. They just thought, well, he's playing with his hair. So, I would pull on it enough and pull out chunks that eventually I just have to shave my head. Well, when my head is shaved, there's nothing to get a hold of. So luckily for me, that's enough. Some people have trichotillomania way worse, and they're pulling on pubic hair, or arm hair, or facial hair. If I keep myself trimmed like this, I can't get a hold of it. But the minute there's enough to grab, I start yanking on it. But yeah, my family truly and honestly believed this wasn't a symptom of anything. It was just a bad habit that I picked up. That's really what they thought. They thought it was a bad habit.
Who was your support system when you became diagnosed with your mental illness?
I lived here in Columbus, Ohio, and again, my family was away, and they didn't know anything. A woman that I was casually dating at the time, and I say casually dating because it's a family show, she understood. She knew the symptoms of mental illness. She had major depression herself. Her mother was a psychiatric nurse. She had, taken like psychology classes in college. I mean, she was well read. She was educated folk. I was blue collar folk. She spotted the symptoms. Now, she didn't know exactly what was wrong, but she knew something was wrong, and she felt that I was becoming suicidal. And she was like, this is erratic behavior. This is not normal. This is alarming. And one day she came up to me and she said, "Are you planning on killing yourself?" And I looked at her and I said, "Yes." I mean, that was the answer. I thought everybody thought about suicide. So while she was the first person to ever ask, I still didn't really think it was an odd question. I thought it was a reasonable question. So I said yes. She kind of freaked out a little. I mean, just a little. And she said, "Oh my God, we need to go to the hospital." And I said, "The hospital? Why would we go to the hospital? I'm not sick. Sick people go to hospitals." She's like, "No, we need to go to the emergency room." Again, there's nothing wrong with me, lady. I really thought that she was nuts, pardon the pun. And so we bantered back and forth for a little bit, and she said, "Look, I'll tell you what, here's what we're gonna do. We'll get in the car, we'll drive to the hospital, we'll talk to the doctor, and the doctor will decide if you're right or I'm right. If you're right, you get to be right, and I'll buy you dinner." And I say, to this day, even in my suicidal, delusional, and depressed state, I had the overwhelming desire to win an argument. So we hopped in the car, we went to the emergency room, and I think we all know how this ends. She was right, completely. I was completely wrong. It turns out wanting to die is abnormal. I was diagnosed with bipolar disorder. I was committed to the psychiatric hospital, where I stayed for a few days. And that did start the journey. And for the next several years, she was my support. She was my caregiver. She drove me to appointments. She helped me understand. She talked to me when I cried. She yelled at me when I didn't take medication. And I don't mean yelled at me like in a mean way. I mean, she just, for lack of a better word, she was kind of like live-in case management. It was scary. It was scary, but she understood. She was really probably my first interaction with what now is called peer support, because where I was going, she had been. And she helped explain things to me, and she helped keep me organized. She even helped with things like insurance. Insurance for major medical issues is just an incredible pain when you're well. And she helped with all of that. She also helped educate my family, which, again, was an incredibly slow process. But the more they understood, the more I understood, the more we talked with each other, the more we all understood. And that just, that nucleus of knowledge, for lack of a better word, grew. And we all taught each other, and my family started listening to me. So I don't want to say that she was my only support system, because I did have my family. And as more and more time passed, my family got better at it. And then I had them as support as well. And I also had support groups and things like that. But I have to give a nod to her. She was she was definitely numero uno for a long period of time before other people started to help.
Okay, so that's a nice place for me to ask this follow-up question, which is, for those people that don't have that numero uno, how do they go about recovery and even identifying that there's an issue and getting the help that they need?
This is a question that keeps me up at night. I think about this all the time. First off, I'm lucky. I'm lucky for an incredible number of reasons. First, I'm lucky that I had money. I can't, it cost it. My care over the next 4 years was, a couple $100,000. I was able to be hospitalized. I was able to see a psychiatrist, every 4 to 6 weeks. I was able to try the best medications on the market. I was able to go to intensive outpatient treatment, which is where you go to the hospital for like 8 hours a day, 5 times a week for 6 weeks. I was able to do that twice. I was able to go to support groups led by psychologists and psychiatrists. There wasn't really any sort of care that I wasn't able to afford. So that was so important to me. Two, I did have a good family. While they made a ton of mistakes, they didn't run away from me. They were there for little things. My whole family helped me move out of my house into a smaller apartment when money got tight and when I lost my job. And of course, when I did lose my job, I had plenty of people to talk to me and say, hey, it's okay. You're more than just a job. You're going to focus on wellness. And that helped, pump me up. And of course, as you said, I had numero uno who kind of helped, guide me and was there for the low points. And then, of course, I worked really, 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 really hard. Somebody who doesn't have all those resources, they only can have one of those things, and that is to work really, really, really hard. Maybe they can have two of those things because they can work really, really, really hard and they have a really good family. But if they don't have the money, they're not going to have access to the same amount of care that I did. And then even that kind of fractures out. There's plenty of people that have great health insurance, but maybe they live in, rural America where there's not these programs, where they can't afford these programs. Or maybe they have the money, but they don't have, numero uno and they don't have a good family. So if you don't know what to buy, the amount of money isn't going to be helpful. So the advice I have is to get all those things. And that's just such crummy advice. But you kind of need all those things. You need to have a way to pay for treatment because treatment is so important. You need to take your medications as prescribed and get the right medications, and that's so important. You need to have a support system because that's so important. There are things that you can do if you're not as fortunate as I was. One, support can come from many places. Find peer support groups. Find consumer-operated drop-in centers. Find a sponsor. Find people who have been there. There's lots of free support groups sponsored by mental health charities all over. Find a buddy. Find a buddy who is willing to help you and be respectful of their boundaries, ask them questions, go to all of the appointments, even when you don't want to. Even if you've been in the same clothes for 5 days and you haven't showered, find a way to get to that appointment. The people there will understand more than you think. And that should help with the support piece. If you don't have health insurance, you got to find health insurance. I mean, apply for disability, apply for welfare, apply for Medicare, apply for social services. Some people that I talk to are like, well, I don't want to do that. I don't want to be a mooch. Listen, it's a social safety net for a reason. You're going to use that safety net to get well, and then when you're well, you'll be happy, you'll get back to work, and your work and earnings will help fund the safety social net for the next person. And that will keep the whole thing moving forward. Just fight really, really hard for a better future and find the things that you need. As much as I hate to say it, it does boil down to advocacy. You're now sick and you have to advocate for yourself. And this is an overwhelming task, but it is not an impossible one. I will be the first to admit that it was easier, and I want to stress easier, for me because I had a lot of these things ahead of time. And I want to be clear, I didn't earn these things. I didn't earn coming from a good family. I was born into them and they were good people. So thanks, Mom and Dad. But I still had to work really, really hard. Nobody forced the meds down my throat. Nobody forced me to be honest with the doctors. Nobody forced me to try and try and try. And every time I fell down, while people were there willing to help me up, they weren't willing to pick me up. They were willing to be part of the help. They weren't willing to be all the help. Maybe said a better way, they were willing to help, not do. Because nobody can do it for you. And you just have to keep moving forward. Because forward is the direction that you want to go. And so often I talk to people like, it's taking too long. It's going so slowly. Yeah. It takes a long time. But if you're moving forward, you'll get there. This is kind of like a tortoise and a hare situation. The tortoise did get there. Really, really slow, but he got there.
So you spoke of self-advocacy and accessing the resources within the community, and you spoke about pride being an issue or a barrier as to why some people may not want to reach out to the resources within their community. But it's because of my experience in mental health, I would say there are a lot of resources within the community. But what would be your advice on how people go about accessing those resources, or even knowing where the resources are? Because sometimes they're out there, but who knows how to find them?
This, of course, is really tough because, America is gigantic. If you're in Columbus, Ohio, I'd say, call 211 and ask for resources, and they'll tell you what resources are available. But there's not a 211 all over the nation. My grandparents, when I was first diagnosed, they understood nothing, and they wanted to. They were desperate to understand me. So my grandmother picked up the phone and she called in Tennessee, and she called the local psychiatric ward. She called the local hospital, asked to be connected to the psychiatric ward, and she said to the person that answered the phone, "My grandson needs help, or my grandson was diagnosed with bipolar disorder, and we don't know what to do. Do you have any resources for us?" And they recommended resources in their little town of Drummond's, Tennessee. And that's how my grandparents got started. Do the same thing. Call the local hospital, ask to be connected to the psychiatric ward, tell them what's happening, ask them what resources are available. If you are in need, if you don't have insurance, call the local welfare office. Welfare is not a dirty word. It has become sort of a political buzzword. It has been used to shame people, and that is a travesty. It is a travesty in this country that we look at people who need help and we shame them for getting help. It takes a big person, a strong person, to admit that they need help. And to the cynics that are like, well, there's abuses. Yeah, they have to live with that. The majority of people aren't abusing it. Don't lump yourself in with those people. Don't shame yourself, and don't let other people shame you. And if people are, use it as motivation to move forward at your own pace as quickly as possible and show them. Because speaking purely from experience, did people judge me when I wasn't working? Yeah. Did people look down their nose at me when I lost my job? Yeah, they sure did. Did I shame myself? Oh, absolutely. I was my harshest critic. And the thing that silenced all of that, from the tiny voice in my head to all of the, peanut gallery, is when I got through the other side, when I got a job, when I started helping people, when I started earning money, when I started, winning awards even, just when I made a life for myself and didn't need help from anybody, but instead became help to other people, well, then all of the naysayers were like, oh, never mind. So I'm glad that I didn't let those people derail me. I'm glad I didn't let myself derail me. But to answer the specific question, I would start with the local psychiatric ward, explain your mental health issues and what you need, and ask them what resources they have. I would call the welfare office to find out what benefits that you can get, because listen, it's expensive. You're going to need a payer source. And hopefully that 1-2 punch will get you connected to more and more resources. Don't judge yourself for the number of phone calls you have to make, the number of times you have to call back. If you have to call the hospital every hour on the hour for 3 weeks to get an answer, hey, you got nothing but time. Don't get discouraged. You are the most important thing in your life. Advocate for yourself. Save yourself. I'm not going to lie. You're not going to make one phone call and get the answer that you need. I wish I could tell you. You might. But chances are you're going to be stuck in voicemail hell for a while. You're going to have to call a lot of people back, maybe send a lot of emails, but eventually you will get somebody on the phone, get answers to your questions, apply, stay on top of it, get help, and move forward. And that can be exhausting when you're well. It's even harder when you're sick. But I'm telling you, you got nothing but time. Got nothing but time. Do it. It is so, so, so worth it. I have a dog now. And dogs are awesome. Oh, and a wife. I have a wife now too. So sorry, honey. I feel terrible. My wife's watching this. She's like, oh God, he mentioned the dog first again. It's getting harder and harder.
How did you transition from a mental illness patient to a mental illness patient that advocates for mental illness?
In some ways, I don't know. I'll be the first to admit that, I didn't necessarily have a plan. A lot of my life has been accidental. People say, how did you get a podcast? Yeah, I fell into it. I don't know. I was being a smart aleck one day and I said, hey, we should have a podcast. And the next thing you know, I have a podcast. But the honest to goodness answer is I used those resources for help for as long as I needed them. And after a while, I noticed I was going less and less because I didn't need them as much. So, I wasn't going to as many support groups, etc. And eventually when I got better and better and better, the people around me, my family, were like, hey, the charity that taught us a lot of stuff, they're a national organization. So they exist in Tennessee, but they also exist in Ohio. Maybe you should look them up. So I thought, okay, well, that's a reasonable thing to do. So I called the number and I said, hello, my name is Gabe Howard. I live with bipolar disorder. I want to volunteer for you. And they were like, okay. And they hooked me up and I did like a small volunteer job. And then I did another small volunteer job. And then I did another volunteer job. And, apparently I was good at it and they like people that work for free because I just kept doing volunteer jobs. And eventually, those little volunteer jobs turned into a paying job. That organization eventually hired me because I was unemployed at the time. I was doing good work, and they were pleased to have me. So that was a great situation for both of us. And I worked there for 3 years until I outgrew that job, and then I hung out a shingle on my own because one of my jobs there was public speaking, education, community relations. So after I left there, I really wanted to expand my writing and my speaking. So I sort of launched a career doing that. It's also how I ended up getting the job here at the Peer Center. And, so I have this combo deal of, I work at the Peer Center by day and I work in writing, speaking, and podcasting by night. And so I just have like 800 jobs. But that's kind of how I got into it. I literally started out as a tiny volunteer, and that organization kind of massaged that relationship into more and more and more work until eventually they did pay me for it. And that was great. It was a great situation. I got to do what I love and get some money coming in, and that was fantastic.